So thanks for joining for cost-sharing subsidies. We're going to talk today about what they are and how they work. So as most of you probably know by now, new affordable health insurance with coverage effective as early as the beginning of next month, January 1st, 2014, is open for enrollment through the health insurance marketplace now through the end of March 2014. And many people enrolling in health coverage, in fact several million, will be eligible for financial assistance in the form of cost-sharing subsidies and tax credits to help them cover the cost of insurance. So this is just a visualization of the financial assistance that's available. Families making between 100 and 400% of the federal poverty level are eligible for financial assistance. Families up to 250% of the federal poverty level are eligible for cost-sharing subsidies, which we'll talk more about in this presentation, while families at 400% of the federal poverty level will be eligible for premium tax credits to help with the cost of monthly health insurance premiums. So more on the premium tax credit is available in other webinars in this series, but this presentation is going to focus on that cost-sharing subsidy that's available to families and individuals up to 250% of the poverty level. So these cost-sharing subsidies are available if your income, like we just covered, is 250% of the federal poverty level or below, and that equals about $59,000 for a family of 4 in 2013. And they're only available to individuals and families who purchase a silver health insurance plan on the marketplace. And there's more information on the types of health insurance plans that are available on the marketplace in the What Type of Health Insurance Can I Buy webinar in this series. So cost-sharing subsidies reduce out-of-pocket costs like deductibles and co-pays and co-insurance. And they also cap the total annual out-of-pocket expenses at lower levels. So in 2014, the out-of-pocket limits generally will be $6,350 for an individual and just below $13,000 for a family. But if you qualify for subsidies, that cap is just over $2,000 for an individual or about $4,500 for a family. So much lower for those folks that qualify for these cost-sharing subsidies. And if you qualify, the subsidies are applied automatically when you sign up for insurance through the marketplace. So this is just some information about income levels and how much of your out-of-pocket expenses you'll be expected to cover. So between 100 and 150% of the federal poverty level, and again, those numbers there for a family of 4 show you what those income levels look like. You're only going to pay about 6% of your total out-of-pocket expenses. And then that goes up to, if you're at 250% of the federal poverty level, you're going to pay 27% of your total out-of-pocket expenses. And this is compared to the general population who's eligible for this, or who opts into a silver level plan. They're going to pay roughly 30% of the out-of-pocket expenses under that plan. So this is just an example to show you what this looks like. John, Maria, and their adorable 5-year-old twins have a household income of $31,322, and they're right at 133% of the federal poverty level. So at that income, the family is going to be responsible for only 6% of the total out-of-pocket expenses. And again, this is compared with 30% that a family not getting the subsidy would be responsible for with a silver plan. Additionally, their total out-of-pocket spending for the year will be capped at no more than $4,500. So to determine whether you qualify for a premium tax credit or this cost-sharing subsidy, and if so, how much you're eligible for, visit healthcare.gov or call 1-800-318-2596 today. And we just want to mention that we know that the rollout of healthcare.gov was, of course, rocky, but things are much better now, and we encourage everybody to go to the website or call this number today to get started with their application so that your health insurance coverage can start as early as possible in the new year.